Hey guys, Dr. Kyle Loveless here, your wellness expert, and I want to take a moment really just to dive into a video to teach you guys about one of the most important things I believe really going in, especially going into the new school year, about our kids' health, but even as adults, we spend a lot of time doing phones and things like that, and finding out what's actually happening in our body is so important. So there's a concept that's called text neck, and ultimately it is what it sounds like, but it is a medical diagnosis. It's something that you can actually get diagnosed with, and it happens from what we all do on a regular basis. We head hunkered down like this on our phone, zeroed in, whether it's text messaging, whether it's social media, whatever it is, just being in this position has a huge negative impact on our health. Okay, so again, I'm Dr. Kyle Loveless. I have 2 clinics in the Charlotte area, along with my wife and Dr. Holly, and Queen City Health Center is the name of the clinics. And as I'm going through this video, I'm going to ask you guys a favor just to share this information, really help get this stuff out there, because it's a little bit different than most people are being taught. Usually we're taught about symptoms or things that we might already be dealing with and how to get rid of them. But what I'm going to talk about today, a lot of what I'm going to talk about is prevention, because if you're doing this concept of head down all the time, your kids are on the phone or Game Boys or whatever they call these games nowadays, it's going to end up looking like some of the necks that we're showing you, and it is huge when it comes to health issues down the line. Big deal. So first thing I want to start out with is the concept of how important your spine and your nervous system is. Ultimately, anytime a patient comes into our office, the first thing I want them to learn is what health actually is. I think that's the missing link right now in healthcare. Is most healthcare providers couldn't even answer this question right now of what is the definition of health. But for sure, every person in daily life doesn't know what this definition really is. And if we want to have something, we need to know what it actually means. Right? If I want to get to, let's say, California, I need a map to get there. Well, if I want to get health and keep health for the rest of my life, then I'm going to need to know what it actually is. It's a really good idea. I always talk about having a blueprint or having a owner's manual to the body so that you know how to take care of it. Knowing what health is essential. Okay, so I'm going to start out with that. And I got a little PowerPoint for you guys here to make it easy. The definition of health isn't that you look good. It's not that you feel good. It ultimately isn't even that you're disease-free. Those things are all good, but we know plenty of people that are sick, that feel good and look good, and then get diagnosed with something like cancer, which has been developing in their bodies for years. We have people like Patrick Swayze and all these other celebrities who one day they're super healthy, the next day they're diagnosed with cancer. And we know that our best technology when it comes to cancer, it needs to be there for at least 7 to 8, maybe even 10 years of developing in the body. So we know that once you find the disease, you're already sick. Once you have the high blood pressure, you've already built a disease process in your body. Once you see severe things like chronic neck and back pain, you've already built the disease process. We don't want to wait till then. The definition of health, it's the optimal functioning and healing of your body. It's not merely the absence of disease. Okay, and that's the definition. Ultimately, health is how well your body is functioning, how well it's healing, not simply that you feel good. Okay, so to get that out of the way to start out, knowing that everything, and this is so cool because if health is based on how you function and how you heal, then any decision you make in your health, okay, listen to this. This is really super big. Any decision you make in your health needs to go back to this. Okay, so if the doctor says you need to take this medication, your first question should be, is this going to help me function and heal better, or is it going to interfere with my body's ability to function and heal? If I have a back surgery, is it going to make me function and heal better, or is it going to interfere with my body's ability to heal? If I take this supplement, and so on. Do you get my point? So it's a basis you can really use to figure out how to be healthy and if you are healthy. So basing your health on how we feel doesn't work. You really got to understand that health is that you're functioning and healing at 100%. One of the things that I think is so important is if health is functioning and healing, then we need to look at, to tell if you're healthy, you have to look at what controls all the functioning, all the healing in your body. Okay? And there's one main system that controls everything else in our body. I'm starting out with this for a reason, but it's a huge thing to know that your nervous system, all right, the central nervous system, your brain and your spinal cord control everything. You know, for your heart to beat, for your lungs to breathe, for your stomach to digest food. So this system right here, your brain, is literally your life source. From 15 days after conception to your very last breath, this is the life source. The first organ in your body to form is your brain. Out of your brain comes your spinal cord. And out of your spinal cord actually comes nerves. And those nerves go to organs, they go to tissues, they go to cells, and they create really the system that's going to help your body run. All of these other organs are really there to help make sure that your muscles work and that your brain works properly. So your brain controls everything else, and it has to get through here, okay? Because we don't have a satellite system, right? We don't have Wi-Fi from our brain. It's literally a conduit. It has to go through the wire, goes out that nerve, and then it tells your heart to beat. And then your heart sends a signal back through that nerve. It goes up the spinal cord and tells the brain what's happening in the environment. The reason this is so crucial to understand is that if we're trying to be healthy, we need to look at what controls your health first. All right? It's the same thing if somebody comes to your house to work on, I don't know, the electricity, they're going to go to the board where all the electricity starts, right? And if nothing's wrong there, then they're going to maybe go to the electrical system like Duke Energy or the energy source from where that comes from. Does that make sense? So it's super important that we look at the nervous system first and then start working our way out to investigating all the organs. In the healthcare system that we work in right now, it's all spread out, right? You have a cardiologist, you have a endocrinologist, you have a GI specialist, you have a muscles, you have just all these different doctors for systems. But the problem is there isn't a system in their body that isn't run by the nervous system, and there isn't a system in your body that works by itself. So for us to separate all these different systems and expect to have any kind of critical thinking happening so that you can actually find out what the cause of your problem is and get healthy from it is insane. I'm just going to tell you, it's insanity. It doesn't even make sense. The last thing I want is to go to a specialist for my digestive system, because you know what he's looking for? He's looking for digestive system problems within that digestive system. I've had patients come into our office that literally, we corrected their spine and they got rid of ulcerative colitis. And I had before and after colonoscopies to prove that the actual digestive system went away, digestive system problem went away, and we didn't touch their digestive system. I couldn't even get them to eat healthy. So the point is that your nerves control it all first, okay? The reason I'm starting out with that is because it sets a base for everything else I'm going to talk about, okay? So my next step to dive into this is to really understand what your spine should look like, okay? Because text neck is actually a reverse of the normal structure of your spine because of what you've done on a regular basis, whether it's text messaging, whether it's reading all the time like this, whether it's being on a computer all the time like this. They're all similar concepts that lead to the same end result. So a normal healthy neck, let's start with what normal looks like. A normal healthy neck, you can see the eyes and then mouth and all this. This is the front, this is the back of the head, and you see the nice curve. Okay, you see a nice good curve. You want about a 40 to 45 degree curve. That's a good sound structure. For all you engineers out there, you're gonna love this, that bridges are made with 30, 60, 90 degree triangles because of the strength, right? Well, your neck and your mid-back and your low back have 30, 60, 90 degree triangle curves, or are supposed to, for your strength of your spine. So the first reason we want this is we want to be strong. The second reason we want to have a curve in the neck right here is these gaps right here are called discs. And in between these discs are fluid for cushioning from gravity on the body. So right, we have the weight of the head and you have gravity pushing down. Well, when you have a curve, if you can draw a line straight like this, what that's going to do is it's going to allow the weight of gravity to distribute evenly throughout your spine. So I got a little technical there. Let me just step back. Ultimately, what that means is if you're here instead of here, that's going to allow your body to operate better. Not only that, that's going to keep you from having the hump. The reason we get a hump is because when the head goes forward, it builds stress, and the body puts on a fat pad as a resistance. It's a normal response to the body. And then we get in this position. If you look at our kids, most of them look like this. I share a comment on here. If you know someone younger than the age of 20 that looks like this, and they're on Game Boys and phones all the time, right? iPads, and they look like this. So just comment on there if you know someone that looks like that. I know when I go to football games or basketball games and watching high school events like that, all these kids are out there like this because our society literally is turning into this. Adults, most of our patients that come in have forward and you can see that spinal cord is nice and relaxed. It's kind of like if you took your hand like this and it's nice and relaxed, right? So the spinal cord is relaxed and there's no pulling or stretching on the nervous system. It has the opportunity to do what it needs to do and operate. So structure is absolutely important, and that's why they've created a diagnosis for something called text neck. Now let me show you what a text neck actually looks like. I think that's my, oh, not yet. So from that curve, okay, so these are the vertebrae and the discs that I talked about. These are these yellow things are actually spinal nerves that come out and they go to organs, they go to tissues, they go to cells. Yeah, if you've ever had numbness, tingling into your arms, it's typically because these nerves have pressure on them causing tingling or numbness. If you've ever had a sciatic nerve pain or pain down your legs, it's most of the time it's coming from right here. It hits that nerve or inflames that nerve and causes numbness, tingling in your legs or in your arms. So that's a normal, healthy concept here where everything lines up, nothing's shifting out of alignment, everything's moving the way it's supposed to. Now, a subluxated spine is where, and subluxation means it's out of alignment or just simply is fixated. These vertebrae, see how these line up and then this one shifts backwards? Now this is extreme, it doesn't normally happen to this level, but just to give you the concept of it, it shifts backwards, it either hits or irritates that nerve, and now you have decreased flow of nervous system energy to the organs and to the tissues and the cells. Now that nerve right there, let's say that nerve is right here, and let's say that nerve goes to your heart. Okay, listen to this right now. If that nerve goes to the heart, it might not shut down your heart immediately. But is your heart going to build health or is it going to start building disease? That's the beginning of what can cause something like heart disease because there's lack of energy flow. There was a really good study. This was back in the early 60s. If you want, just ask me for it if you want it. But in this study, they actually took cadavers of cats and humans, and what they did is they went through at each, why, you know, whether the animal or the human, why they died, and they went through each spinal level, and they found that the reason that they passed away, let's say they had a heart attack, well, if they had a heart attack, it was directly correlated to the nerves going to the heart. Literally at a spinal level, there was degeneration to those nerves going to the heart. They looked at every different area where that person or animal had died, and it was 100% correlation between the nerve root and the actual organ shutting down. 100% correlation between this and the organ shutting down, meaning that is your life source as long as you have energy flow. Remember, I always say that our bodies have this optimal ability, they have this amazing ability to function and heal. And if you're healing at 100%, you're not going to build disease. That's ultimately what health is. If you have a symptom or a disease process, that means your body's not healing. The first place you have to look is the nervous system. So we look at the nervous system, and when you look at this, I don't know if y'all can see this, but these are phases of what's called degeneration. After I show you this, I'm going to show you what a text neck actually looks like. And you're going to see what some of your kids, 16, 15, 10-year-olds, what their neck actually looks like when you see them like this. It is horrifying because they're only 10 years old. It only takes 10 years to create disc degeneration once you've already had damage. So optimal is a nice, good 43 to 45 degree curve. Phase one is where you've lost the curve, and sometimes it can actually go backwards. And I hope y'all can see this, but ultimately what you're doing is instead of curve this way, it starts to go this way, straight up and down or backwards. Phase two is when it's been in phase one long enough, 10 to 15 years typically, you're going to start to see disc degeneration where you actually start to break down the spine. And then phase three is where you're going to see major disc degeneration. Typically phase three and phase four are where they're recommending surgeries. So what this means is if your child at 10 years old has a phase one neck, I hope so many people are listening to this right now who's really hearing me. This is huge for prevention of major health problems for your child down the road. Phase one, if they're in phase one now, look, gravity's pushing on their body. It will always do this unless you do something to get it back this way. Okay, so you literally have to do something active, proactive, to get them this way. Otherwise, it will always do this. And you're thinking 10, 15 years, if you're 10 years old, 20s, in their 20s, they're going to have disc degeneration. That's scary. They're finding, in the studies they've done, they're actually finding disc degeneration in kids, or in people in their 20s. And then phase three in their 30s or 40s, and then they're 40 years old, 50 years old, and they're in phase four degeneration of their spine. That's wild. And you know, so many people think that disc degeneration or arthritis is an age thing. it's not actually so much just an age thing, okay? And a bad spine isn't an age thing. I have 67-year-olds that are more in phase 1 or even normal. And I have 10-year-olds that are in phase 1, not phase 2 because it does take time to create disc degeneration, but phase 1 where it's completely reversed, and I can promise you they're going to be into phase 2 in their 20s. And what that means is, let me just make this really bring this down to earth here, I guess you could say. If you have a phase 1 spine now, within 5 to 15 years, there's going to start to be disc degeneration or a disc herniation, okay? What that means is it's going to be typically neck pain, okay? So typically pain in the neck. Over time, it'll cause numbness, tingling into the arms, into the hands. If that nerve in that area goes to an organ, let's say in the lower part of the neck, the nerves, or upper part of the back, the nerves go to the heart and lungs. So if you're here, you're directly putting pressure on that part. So those nerves go to your heart, into your lungs, okay? That's eventually going to shut down or irritate the heart and lungs, and you're going to start to see heart disease and lung disease. This isn't a theory that I just think might happen. They've actually done the research and studies on this. They did a huge research where they showed that men, when they go from here to here and have loss of height, forward head posture, it massively, I don't have the exact percentage for you, but it's a very high percentage, increases their chances of heart disease and lung disease. And it's directly coordinated to, bam, right there, the nervous system. So super important to know that if your kids right now are at phase 1, they will be at phase 2 and phase 3 unless we do something to bring it back to this direction. We're not trying to make fear or anything like that, just awareness that there is something you have to change. We live in a different world. If you're in your 30s or 40s or 50s, when you were a kid, you weren't sitting there like this all day, okay? I still see disc degeneration in 30 and 40-year-olds, but imagine if you were like this all day long, all these computers, everything technology, and then you're carrying this heavy backpack around, and then you sit all day long, right? And then so we have some kids who are sleeping on their stomachs all night like this, like causing neck problems. So now we do all those things, and then bam, in their 20s, we're taking an x-ray of their neck because they have neck pain or because they have migraine headaches, which stems from the upper part of the neck, or maybe they have a thyroid problem, or maybe they're numbness tingling into their hands, and we're taking an x-ray and they're in phase 2. I hope to God that doesn't come to the day, but it is coming fast unless parents really start to realize that there is a very important part of our health that we're missing, and that is your spine and your nervous system. That you're only as healthy as your spine. And the thing about the spine is you can't get another one, right? They have heart transplants, they have kidney transplants. They don't have spine transplants. You get one. And for the best thing you can do for your kids is to help them get this back to normal and take amazing care of their spine, because that it really is their life source. Okay, if you've never had that checked, go to queencityhealthcenter.com and look us up online. If you're in Charlotte, if you're in the Charlotte area, go to queencityhealthcenter.com. You can schedule an appointment time for Matthews or Charlotte area for your kids to get checked and for you to get checked and to see if you actually have a text, neck, or damage. If you don't live in this area and you want to find out more about how to do this, simply message me. I'll make it private. Message me and I'll just I'll forward you to someone in your area. I have a group of doctors all over the country that are happy to do this for you. So I'm going to go into what text neck starts to look like. Okay, now this is a smaller version of text neck. Now if I showed you this person's neck that should be like this, okay, their back is way over here. I mean, this person, when they came in, they were like this. Okay, this girl is literally 22 years old. Okay, she just she graduated college. Now she's going on to graduate school. So she came in. This is the first x-ray she took in our office, and instead of being here, her neck is completely straight. She still has discs because she's young, but eventually in 5-10 years, she's going to build disc degeneration if she doesn't have a disc herniation, because the weight of the head is 12 to 15 pounds. All the weight of her head is going into here. It'll eventually either herniate or degenerate. It's just physics. Ultimately, we have to get the curve back in. Okay? The reason I'm showing you this x-ray is because she's only 22 years old. Okay? This next x-ray right here, which has a bit of a curve, a little bit of disc loss right here, but a bit of a curve here, way less forward head posture. Here's the difference. This person's 65. This is actually her mom, and this person is 22. Does that make sense? It's not an age thing. Even though she has some degenerative changes there because she has some ligament issues there, huge difference. Okay, so when she's 62, what's her spine going to look like? Well, all these discs are going to be gone. She's got major issues if she doesn't do anything to correct it. So I want you to know this is not an age thing. This is similar to a text neck. Text neck can actually even go the opposite direction. Okay, this next x-ray, this one is actually a 15-year-old little girl that came into our office and took her first x-ray. All she had was anxiety, sleep issues and anxiety. Very common in the world today. And the reason you get anxiety for this is you have a spinal cord that goes through here. When you stretch your spinal cord, let me show you this. This is pretty specific and clear here. So you have a curve in the neck, okay, and you can see the yellow in there. When you take the neck and you go like this, okay, like hers, this is what her neck actually looks like. You see that spinal cord? It actually gets stretched. You have something surrounding, and again, I don't want to get too specific, too intense here to kind of speak over your head, but I think it's important to know how your body works. And so you stretch that spinal cord. Well, around the spinal cord, you have something called dura mater. Okay, we've all heard of an epidural. That's where they go underneath the dural with an injection to get rid of pain if you're someone having a baby, and they do it for back pain too. So this dura mater, when it's stretched, okay, so when we go into a stress response or a fight or flight response, our dura mater stretches, okay? So when that dura mater is stretched, it puts your body into a fight or flight response. What I'm saying is it stresses you out. It puts you into stress mode. So if you're walking around, this little girl, 15 years old, is walking around with her neck constantly being stretched, the dura mater is being stretched, fires the sympathetic nervous system. Her sympathetic nervous system is constantly firing, and she has anxiety. No wonder she has anxiety. No wonder she can't sleep. I'm really surprised she didn't have a lot more symptoms. Biggest concern is what about 10, 15 years from now? Good news is she did start caring. She's getting change in her neck, but that is a big deal. There is spinal corrective protocols you can go through to change that. Okay, and then the final one I want to show you here. Well, actually, that's what I want to talk about there. So those are the X-rays. Okay. And I'm talking fast here. Hope you guys are sticking with me. Hey, again, like this, love it, and share it. This stuff can transform lives because nobody's talking about this, right? There's no one out there saying you have to take care of your spine too, not just your digestive system. I love digestive protocols and liver cleanses, and all those things are amazing. Great herbs out there and things like that can detox the body. But you know what? If the nerves go into your gut, your digestive system, if I cut those nerves, all that other stuff falls away. Acid reflux, like there's all kinds of protocols we have for that. But you know what? If the nerves in the middle part of your back that go right to the sphincter right there, esophageal sphincter, if that is supposed to close and keep HCl down, if the nerves going there aren't working, it's not going to close, and you're going to have acid reflux. That's why when we fix that area, you can see change in acid reflux. So my point of the matter is that the nervous system is super important. You only get one. So I want to talk about text neck and some things you can do to prevent it. Now that you know what it is, it's the loss of the curve in the neck going the opposite direction, okay? Just be really clear, it's where the neck goes from curved to that position. When you take if you took an x-ray of someone staring at their phone, it looks like this. And what the body does is with enough repetition over and over again, it actually trains itself to be in that position. You get a muscle memory. So you can say, oh, well, sit up straight. You can try that. Problem is it's going to go right back here as soon as you relax. And so it literally is a memory in the muscular system. Okay, and the protocols that we do are to get that memory back to the position it should actually be in and stop doing the stuff we're doing on a regular basis. So here's some prevention for you. An ounce of prevention, yeah, you all know the saying, right? It's a pound of calls or whatever, I don't know. Ounce of prevention is good. So we got text neck here. The first, I'm just going to give you 5 quick things that you can change, okay? Number one thing you can do is pay attention to posture, okay? And what I mean by that is if you're on a phone, instead of being like this, hunkered down, bring the phone up. Cool? Just bring your phone up. Maybe lay on your back and do it from this position, okay? If you're on social media and you want to stare at Facebook, stare at the Facebook, right? But pay attention to your posture while you're doing it. Another one is going to be, okay, instead of sitting all day long, and this counteracts, it doesn't have to do with just texting, but instead of sitting at the computer all day long, maybe get a standing desk. That could be very valuable for you. You can also do every 15, I did a video not too long ago on sitting and how bad that is for your health, but every 15, 20 minutes, get up and move. Move your spine around, get the nervous system moving again, and get your discs in your spine moving so it doesn't train itself to be in this position, okay? And I'm gonna say screen time, especially for your kids. So let's limit screen time. And there's so many other health reasons why to limit screen time. The pediatric journal of Pediatrics actually just came out this last month, I believe it is, and then you can find if you Google this, but they came out with regulations or recommendations on how much screen time we should allow our kids to have. Okay, so we got this concept called screen time. And the reason they're making these recommendations is because they're finding out that it's extremely, the blue screen, that all this input at once is extremely addictive for our kids and actually for people, and it stresses people out. It puts them into a stress response, which we have so much constant stress, we're not getting back to homeostasis fast enough, okay, to balance, and we're building disease because of it, because our body can't balance itself. So they have screen time recommendations. Screen time is so important to keep away from, not only for text neck, but because of the stimulation to the body and the nervous system. And so what they said was anybody before 2, so if you have a baby, I guess, or a toddler before 2 years of age, they should have 0. They should not see a screen. Okay, and I know that's a technique. It's like here's the video to watch. They shouldn't see the screen before age 2. That's from the Journal of Pediatrics, because the research has proven how bad it is for your kids. 2 to 5 should be no more than 1 hour a day. I'm going to recommend keep it away from them. They're still 5 years old. If they don't even know what it is, there's other things. Think about, call your parents up and say, hey, what did you used to do with me before screens were around? They'll give you some ideas. But the pediatric journal says no more than an hour. I think they're being soft on that. I would say don't do it at all still. After 5 years of age, it increases a bit, but there's still a timeline. And even for adults, we really shouldn't be spending as much time as we are on screens, okay? That's an amazing way to help with text neck, but it's also an amazing way to help with your overall ability to get back to rest and relaxation and homeostasis. Number 4, I'm going to put it here is, because we're talking kind of about kids here, is backpacks. Okay, and this isn't a talk on backpacks because of time, but I would just say go Google how do you wear a backpack properly, and make sure your kid's backpack isn't heavier than they are, right? Or make sure it's not so heavy that they're walking like this. When you put your child's backpack on, they should be able to stand in a normal position, otherwise it's causing them to pull into that text neck position, okay? Cool. The final one I'm going to recommend that I see that leads to the same thing as text neck, even though it's not from texting, is, let me put this plant down just in case it's in the way, is sleeping prone, okay? And that means on your stomach. So sleeping like this with your head turned all night long literally puts, let me just show you what that does. I think it's good to get visuals here. So you're sleeping on your stomach and your head's like this. Well, that's going to take your spine all night long. It's going to be twisted just like this, okay? All night long. We have ligaments all through here. Those ligaments get lax or get loose over time. And what I see on x-rays for people that sleep on their stomach, instead of being curved like this, is you'll see a reversal, usually in the lower part, and then it'll curve back. I can't even do it with the spine. It's really awkward looking, but it's this like S curve. This is what happens because of ligament damage in the middle part of the spine. So, very important to do those 5 things, okay? Posture, stop sitting as much, screen time, limit that, look how they're wearing their backpacks, and then sleeping, get them not to sleep on their stomachs anymore, or for you, this is an adult thing too, not sleeping on your stomach anymore. Very big. So the next step I want to dive into is what is the fix? So if you already have a text neck, how do you fix your text neck? The first step is you have to find out what your spine looks like. If you're like this, good possibility you have a text neck issue and you need to have x-rays. First step is x-rays. We do that here, but there's any other chiropractor you go to, you can go to your medical doctor and get the x-rays too. The problem is there's no real fix for it on their end. They're going to use some home exercises and stuff maybe, but it takes more than that to actually fix it. So I'm going to recommend, number 1, I'll recommend chiropractic care. Okay, and this is a little boy that came into our office, and he was literally 6 years old, reverse curve in his neck, on a ventilator, had all kinds of asthma and breathing issues, steroids every single day. He went through I want to show you before and after, how we can actually fix this. Before and after, he came through 36 visits later, and you actually have a curve in his neck. Same little boy. This is old school x-rays here. This is back when we had to do the films and everything. But reverse curve, negative 10 degrees, positive curve, 40 degrees. Came off his ventilator, came off his asthma machine, and no more steroids. And he's pretty much, he's medication free, normal boy, getting the curve back in his neck. That's super cool, right? That's life force right there. That means his body can heal and work the way it's supposed to. This woman came in her 30s, anxiety, depression, just all kinds of health issues overall. and reversed curve. So her spinal cord is constantly being stretched, puts her in a fight or flight response, shutting her system down, causing her to have anxiety and depression within months. Usually we do a 36 to 40 visit plan. Sometimes it's less, like 24 visits, depending on if it's not severe. But she went from -8-degree curve, 21-degree curve, gets to chunk her antidepressants and anti-anxiety meds into the trash can because she does not need them anymore. That's awesome. Okay, this last one, and this patient came in, she actually went to a chiropractor for a long time, and this is not against any chiropractic at all, but there's different types. There's adjusting, which is amazing, gets pressure off the nervous system, allows the body to heal at a much higher level, and you can see miracles happen with it. You can see ear infections go away, digestive problems disappear. And in the long run, though, we also want to get a structural change within the spine, and that takes chiropractic to a next level, which is going to be a level up, which is going to be correction. Okay, and there's protocols for correction because this person came in and had a reversed curve in her neck. Even though she'd gone for over 1.5 years to a chiropractor, her symptoms were still constantly coming back. She'd been, but it kept coming back. And her main symptoms were menstrual cycle issues, migraine headaches, neck pain, and back pain. So we took her x-rays and reverse curve, and ultimately, again, stretching the spinal cord. So we took her through the adjusting protocol, but we also took her through a range of motion, exercises to retrain all of this. This is all muscle right here that has to be retrained. So you can retrain the system as long as you do the proper protocols and exercises at home and muscle work and adjusting in the office. So she goes from here, we did her 36 visit re-x-ray, nice perfect curve in her neck. This isn't a different person, look, same person. So I'm not trying to pull anything around you here, but ultimately that's a better curvature in her spine. Her body's functioning, healing at a much higher level. Happy customer as well, but ultimately that is a tech's neck. That is exactly what a tech's neck looks like. And this is what it looks like after you go through a corrective protocol. And now she does her stuff at home. She hardly ever comes in, and she's doing her stuff at home to make sure it stays that way. Okay, so that's the setup, guys. Ultimately, text neck is a big deal. It's something that can truly change your life negatively by destroying the way your body works. And it does that by stretching the spinal cord, shutting down the organs because the organs run on the nervous system. And it's not an immediate shutdown. You can have a text neck and feel fine. Maybe you get some fatigue, maybe you're tired, maybe some sorenesses in your neck every so often. You don't have to feel anything. Only 9% of the nerves in your body are for pain. So I'm going to repeat that. Only 9% of the nerves within your body actually feel pain. The other 91% of the nerves in your body are for functioning and healing, for your heart to beat, for your lungs to breathe, for your stomach to digest food. The days of just seeing chiropractic here or the spine as something that can cause pain or get rid of pain are gone. We see too many crazy miracles with people coming off of medications from digestive issues, acid reflux, headaches, migraines going away, numbness, tingling in the hands disappearing, people coming before and after colonoscopies. I'm not saying this stuff just to throw a bunch of stuff out there. I'm telling you because your nervous system controls your body, and if we can remove the interference from your nervous system, give you a good, strong, healthy core, which is your spine, and then everything else you do, eat good, exercise, detox the system, think well, right? Focus on prayer, meditation. That is a true healthcare system, and that is what it all has to come to. Eventually, if we don't change the healthcare system, when we just go wait till we get sick, we feel a symptom, we go to the doctor, we take a medication, or we get a surgery, we're really looking at a rough future, especially for our kids, because I'll tell you, the worst x-rays I typically see coming into this office aren't the 60, 70, 80-year-olds. It's typically, and they have bad ones too, but it's typically our kids. And I don't want to see what it's going to look like in the future. So you guys, do us a favor, get your kids' spine and their nervous system checked. Do a favor for yourself, do it for you too. Find out if you have text neck, and find out if it's going to have a negative impact on your future. And then from there, start the protocols to correct it if you do have it. If you don't have it, start doing a proactive approach to make sure you don't ever get it. Cool? All right. You guys have an awesome day. I hope that wasn't too long-winded. I hope everybody's still with me. And but like this, love, and share it. This really can transform lives. Hey, if you want to be on this health mission with us, then share this stuff. Get it out for people. All it takes is one seed, one little thing that you put out there that might change or alter the direction of somebody's life, from cancer, heart disease, and diabetes to living life on a cruise ship and just loving life, right? Cool. Thank you guys. We'll talk to you later.